evening. Welcome to tonight's Democratic primary debate for State House District 63. I'm Rachel Chatham, an independent journalist from Southeast Indiana and the moderator for tonight's discussion. Scott Rogers from Who's Left is running production today. Make sure to follow for more Democratic primary election information and other Indiana news. Today's debate is presented by the Progressive Indiana Network, an independent media collaborative supporting Indiana-focused progressive journalism, analysis, and commentary. The network provides a shared platform for writers, podcasters, and creators committed to covering state and local politics with independence and accountability. You can learn more at progressiveindiana.net. Tonight we have three promising candidates: Tiffanie Arthur, Adam Mann, and Tiffanie Arthur.
Hi.
Adam Mann.
Hi.
And Tony Bolen.
Hello.
Thank you for taking the time to join us tonight.
Thank you for having us.
All right, tonight we will be covering 5 categories: healthcare, infrastructure, affordability, education, and housing. You'll have 90 seconds each to respond, but first, each candidate will be given 2 minutes for opening statements. All right, let's start with Tony.
All right, thanks for having us once again. Thanks for this opportunity to reach out and get our voices heard to the public here in our district. So, as a husband and father of 2 in our local school districts here in Southern Indiana, I'm just basically a blue collar worker. First 14, 15 years of my life out of high school, I worked in service industry, whether it be in restaurants, bars, things along those nature, whether it be in leadership or just as a crew member there in the service industry. After that, the last 15 years I've been in manufacturing here in Southern Indiana in Dubois County. I've done a little bit with wood factories here in the county, but last 14 years I've been with the same company in automotive remanufacturing industry as a first year or so in just production, and then in leadership later on, lower level leadership later on for the next 5 or 6 years. Spent some time in quality and customer service, which is what I currently do now as a technical advisor for the automotive industry. And I'm just again happy to be here because we all do have a voice that we need to get out there. There's just too much right now that's going on in the government that it seems like a lot of our there's just that serious disconnect between the government and the citizens here in Indiana, and looking to restore that sense of togetherness, community. It's not supposed to be, this government's not supposed to be ran where it's the top down and where everything benefits the rich and elites in this country or in this state. And yet, that's kind of where we've ended up. Just kind of wanting to restore a little bit of that order and bring that power back to the people and the citizens of this district.
Thank you. Adam?
I'm Adam Mann. I have born and raised in Dubois County, the northwest corner of Dubois County, and I call Jasper, Indiana my home. But I'm here running for office because we have too many reckless laws being made. Not much thought is being put into these laws. I want to offer more critical thinking options, and I am a natural troubleshooter and problem solver, and I want to provide those skills to review what we actually want to do and make sure we're actually doing it. Some of these laws, some of the stuff we're trying to push, we're hitting it the wrong way. I find some of the laws we have as an abuse of laws. It's like anti-abortion is abusive because it doesn't, that's not the problem. We all hate it, but it's not that. Abortion is a symptom, not the actual problem itself. And the economy is really going down, keeps dropping and dropping. And we keep talking about like increasing minimum wage. I need to look at, I look at from both sides because actions have consequences, and that's what we need to be thinking about. It's not about making sure the minimum wage is high enough or making sure hitting a certain amount. It's making sure the minimum wage will pay for whatever the cost of housing, food, water, utilities, clothing at that time catches up. And unfortunately, we have a lot of issues in the economy, a lot of issues with healthcare, infrastructures lacking. We have the discussion on toll roads. There's too much that people aren't really thinking about. Go ahead.
All right, Tiffanie.
Hi, my name is Tiffanie Arthur, and I'm running for state representative in District 63. I've spent the majority of my life right here in our community, and I understand the value of hard work, resilience, and showing up for one another. Today, I'm a small business owner, a mom, and a proud member of our farm community. I've worked in education as a preschool teacher, as a preschool assistant, and spent years supporting young families and children, young people through coaching across our district. And that experience has really shaped how I see the challenges in our communities that they're facing and the kind of leadership that I really feel like we need. I also currently serve as the chair of the Daviess County Democratic Party, where I've worked over the last year to really rebuild and strengthen local engagement because I believe people deserve to feel connected to their government and confident that their voices matter. Because at the end of the day, government should serve the people and not the other way around. And that starts with listening to, representing, and fighting for working families across our district. And I'm running because too many Hoosiers feel like they're doing everything right, working hard, and still falling behind. Whether it's rising energy costs, access to health care, or protecting our farmland and rural communities, the decisions that are being made at the State House impact almost every single aspect of our daily lives. So I believe in putting people over politics, and that means listening first and working across differences and standing firm when our policies hurt our communities.
Thank you. Though this debate is highlighting the Democratic candidates, the purpose of this debate is to highlight issues from the people of Martin, Daviess, Dubois, and Pike counties, and our nation as a whole entity. All right, we will start with healthcare, and we will start with Tony. Southern Indiana is facing a healthcare crisis. Hospitals are closing, claiming there is not a demand, but many areas in Indiana do not have an easy route in an emergency. Injury-related deaths are 40% higher in rural communities than in urban communities. What are ways you plan to attract medical businesses and talent to Southwest Indiana?
So yeah,
Tony.
living in Southern Indiana in Dubois County, we do have a local hospital here. At times their services are a month or two out, there's not a lot of options for where to go. I hear a lot across the state of hospitals closing and everything due to funding. And like you said, if they're not getting used, they're not getting funds. So we need to start looking at where some of these budget cuts that have come in the last cycle, where how they're affecting Hoosiers. We've in this state for the last 20 years, we've been putting profits over people for far too long. And it looks like, that what that's led us down is this road of all that matters is that bottom dollar. Well, whenever they had fear of having a budget shortage, they started cutting everything. However, they didn't cut the income. So we end up with a system, with what $670 million, I believe, was our budget surplus last year. After kicking 100,000 people off of Medicaid, there's 400 to 500,000 people in Indiana without health insurance at all. We need to be able to get those people insured. We need to be able to get them in the medical system. The best way to save those hospitals is obviously through funding, but also at the same time, they've got to be there to serve that community and keep them healthy, not just as a last resort. It's emergency room visits aren't the smart way to go about this. We need to get that the rest of the state insured and get those health services being used.
Thank you. All right, Adam.
What are ways to plan attract medical businesses? Well, we got to make sure we're getting the right medical businesses attracted. So we have to assess supply and demand. Well, first part is demand. And then there's the next part of making sure we have hospitals available. One is offering a fund to help supplement hospitals that have low demand, but because of region and distance, we still need a hospital there. Because even though there's not enough people to support a major hospital, you still need something there. And it's more or less planning and such. Beyond that, we have other reasons why medical people will not come into Indiana because we have some stupid regulations, and we need to address all those regulations, which ones are negatively impacting our health care and which ones are not working enough. There's a certain balance has to be made. What's scaring medical personnel away, need to cut those out. And whatever is, then see about what funding, extra funding and support we can give. That's basic infrastructure.
Thank you. Tiffany?
In rural communities like ours, access to healthcare is just as important to when we talk about affordability, because we can talk about coverage, but if there aren't providers nearby, families are still going to be left without real care. And across our region, we're seeing provider shortages and longer travel times and increasing strain on our rural hospitals. And we really need to focus on strengthening our healthcare workforce. We need to be supporting our rural facilities and making sure that communities like ours don't get left behind. And we have to start by ensuring that our rural hospitals are receiving free or fair Medicaid reimbursement rates, protect and expand our critical access hospital funding for hospitals that are struggling, and stabilization grants for struggling rural hospitals so that they can keep their doors open and continue caring for patients. As a legislator, I would support practical solutions like expanding incentives for healthcare providers to work in our rural areas. We need to strengthen our workforce pipelines through partnerships with our local schools and training programs, and invest in programs that help keep rural hospitals financially stable.
Thank you. All right, next question. 2 in 7 people in Indiana are currently on Medicaid. Indiana is implementing significant Medicaid cuts following a projected $985 million to $2.4 billion shortfall in the state's budget. Over 100,000 residents could lose coverage. What is Indiana's obligation to its most vulnerable residents when it comes to healthcare access? And given that the Healthy Indiana plan already exists as a framework, do you support expanding it to cover more users, or do you have a different vision for how the state addresses the healthcare coverage gap? All right, let's start with Tiffany.
So the Healthy Indiana plan is a fantastic plan to help kind of fill that gap in between your Medicare and your Medicaid, and people, like myself, who is self-employed, and my husband, and, people with those lower incomes. But we have to make sure that we are not letting people fall through the cracks. It's something that I would definitely need to sit down and take a hard look at, because while budgets do have to be taken into consideration, a healthy state also includes making sure that people can receive the care and not be put into medical debt that they can't afford, or not be able to access the care that they need. Because ultimately, if we want to build a strong state, then we have to be able to be healthy also. So it's a topic and a budget that I feel like we would really need to sit down and look at and evaluate how we can expand it within those budgetary constraints without letting the least vulnerable fall through.
Thank you. All right, Adam.
Well, as Tiffany says, it's a budget balance there. If we have the funds, Part of it is we need to look at what tax cuts we're making, but Medicare, Medicaid, we need a baseline for helping people's health, because I can say health around here is actually degrading, but we're not seeing the degradation because it's normalized and people actually think it's normal. Actually, people have a lot of low energy and don't realize it. So Medicare, Medicaid, try to get that work with that budget shortfall, figure out where we're going to get the money, put some focus on having healthy Hoosiers, because if they're not healthy, they can't work to their fullest ability. And if you don't have enough workers, you're not having income anyway. So, but at the same time, if we don't have the money in the budget, if the state doesn't have the funding, if we're not getting enough funding from the federal government like we should, we're going to have to deal with what we have and figure out how to make the most efficient use of what funds we got.
Thank you. Tony?
So I think my biggest concern in a lot of what the government does is letting people fall through the cracks. Those systems, there's always going to be kind of an overshoot. If you're trying to keep people from falling through the cracks, you're going to be accused of being too liberal with your money, basically. And that's just the way things are in this day and age. But at the same time, there are ways to come up with that funding. We've seen overseas in other countries, having universal health care. There's not necessarily saying that that's, the next phase in our development as a nation as well. But at the same time, like, we know that these systems can work if the time and effort's put into it. As far as Medicaid in Indiana, I would like to see everyone in Indiana to have health insurance. Health insurance alone isn't enough to keep you out of medical debt or medical bankruptcy by any means, but it's going to keep you healthy and keep you able to work and able to provide for your family in a lot of situations where, people that without insurance aren't going to be able to do that. One of the big things I think that should be looked at pretty thoroughly, is maybe some type of a tiered system for that Healthy Indiana plan or for Medicaid. If we're going to have a certain income limit for a cutoff of free medical insurance or Medicaid, then there can be other tiers where we basically say under a certain income, you buy in for this much a month, but into the same system so that it gives us that same ability to be able to negotiate with medical providers and pharmacies and pharmaceutical companies here in Indiana.
Thank you. All right, next we'll be discussing infrastructure. A community member from Martin County asked what you will do to ensure rural road improvements. 37% of roads are in poor or fair condition in Indiana. INDOT recently delayed 300 products due to inflation and declining revenue. How will you work to secure funding for road repairs and builds? And we're going to start with Adam.
Well, simplest part is look at the tax revenue, see what we got there. Yes, we have a lot of issues with road funding. I am very much against tolling roads for any reason, because like the comment for the Interstate 70 tolls, you got to spend money for the tolling system. That's adding another cost onto the budget. And where's that money coming from? Well, it's coming from the residences. So that's where we get down to funding. Look at the tax structure, see if there are certain cuts that need to end, and get those roads built, refixed, and such. Although we also need to look at wasteful spending, like this Mid-States corridor we got over here in Dubois County. So, yeah, we need to start with what we got. We need to start fix the roads we have instead of planning new ones unnecessarily. So.
Thank you. Tiffanie?
We've actually ended our last year with a fairly sizable surplus in our budget, according to the state. So I would think it would be time to take a look at some of those numbers and see why that money isn't being spent on road improvements. Like you said, we've canceled hundreds of scheduled road improvement and upgrades. And I think anyone who's driven on local roads knows that they are falling into disrepair, especially through your Martin and Dubois County, where 231 was scheduled for upgrades years ago. And that money then got lumped into the Tier 1 study for the Mid-States corridor. When it comes to toll roads, that is essentially just an additional tax and increased cost for especially rural Hoosiers who have to travel farther for work or to receive access to healthcare. So that seems like a horrible idea when Hoosiers are already struggling due to rising costs across the board. I think it's time that we look at wasteful spending when you have money being spent on things like helipads for our governor and luxury vehicles for his cabinet. I think that we have to really question whether the current administration has been good responsible stewards of our taxpayer dollars.
Thank you. Tony?
Yeah, both Adam and Tiffanie hit on this really well. To put up additional toll roads in Indiana, if that, I'm not against toll roads maybe for funding for a road, but at the same time, that's something that could be discussed. But to fund, our current roads that we have now with additional toll roads is just another tax. There's plenty of other ways to get that income coming in. We don't have to be given all these tax cuts to data centers and to a lot of the big corporations that are already here. We can look at a lot of ways to bring in additional revenue. But again, that $660 to $670 million budget surplus last year, I still have a hard time whenever I hear anybody in politics or in the government say that, there wasn't money to do something in this state. Traditionally, or this past year, so $670 million was overpaid basically by the citizens of Indiana, by Hoosiers. And that money was given to the state as good stewards to be able to take care of our facilities and our infrastructure and, to provide services for those that are given that money to the state. That they're not doing anything with that money. It's not necessarily that they're taking it in that's the problem. It's that those services are not being delivered. We do have too high of taxes in certain ways, but at the same time, once those taxes are collected, at the least you can do is use them to provide those services for the Hoosiers in the state.
Thank you. All right. Rural Indiana roads present a high fatality risk, with local and non-highway roads accounting for 28% of the state's deadly crashes. Indiana ranks 4th nationally for deadly crashes on local rural type streets. What will you do to ensure road safety? And starting with Tiffanie.
This is a very real concern. I live in a very rural county in our district of Daviess County. A lot of roads are very narrow. There are not a lot of shoulders to pull off in case there are, oncoming traffic, especially with the very real factor in a rural community of slow moving farm vehicles, semis, larger vehicles that a lot of times can lead to an increase in fatality if they are involved. I think that there are ways that we can look at different intersections, things just as simple as, I know the bypass of here in Washington on 257, a simple left-hand turn lane with a light would reduce so much traffic and problems. And they have done everything from rumble strips to delayed lights, and we still have a lot of accidents there. So there are some very minimal changes that wouldn't really impact and be expensive, but would have a huge impact, especially in our Amish communities in Daviess and Martin County. The buggy lanes that our counties have put in has seen a big help in that. So I think you can improve those roads by widening, by evaluating intersections and turn lanes to try and help.
Thank you. Adam?
Oh, well, for road safety, unfortunately, this is not I can make a direct answer for anything, because most of the road safety issue is the driver being a little bit reckless, not paying attention where they're going, driving too fast. And I've done my fair share of driving. I have been passed by, yes, I was speeding a little bit, but you're getting passed while like you're standing still, and there's oncoming traffic less than a mile away. Yeah, it's unfortunately most of your road safety issues there, like crashes, is driver related. And I look at that as we got to improve the economy. We have to reduce the stress and the need and the logic and reason to be driving too fast, making too big of risks, not thinking about, oh, you're going over a hill, that's a blind spot. We need to hit that part, which the next part is improving funding for police so they can police the roadways. So, yes, wider roads where they're needed, improved road structures, but we have to address the other part of drivers being reckless. That needs to be addressed too.
Thank you. Tony?
Yeah, I think the big thing is, Hoosiers drive these roads every day. And I don't think there's anybody among us or anybody out there who at some point hasn't been going down the road and narrowly avoided an accident and, thought, hey, well, if it would have just been this way, this would have never even happened. Feedback from the community is going to be a big one. I think getting the community involved, whether that just be signs out, along major thoroughfares or an ad campaign or some way that people can reach out easier whenever they do have an idea for a dangerous area or how to improve that, and just having that conversation with people in those areas, because most of these conversations aren't coming from people that actually live in those areas. They're coming from people in Indianapolis or that live in a different district and serve on a committee. But getting the community that is affected involved, it goes a long way. 231 out here in Spencer County, just south of Dubois County, was known for having a lot of fatalities whenever they first widened the road and made it a divided 4-lane highway. And they put in J turns here, which work great in rural areas. Just some things like that, whenever they do see an uptick in accidents, especially fatality accidents, to get on that right away. Every one of those needs to be investigated. If it can happen once, it can happen twice, it can happen a dozen times. And the state just needs to be a little bit more proactive in getting out there and getting those interchanges fixed, those areas of opportunity, something done about them.
Thank you. All right, public safety is often discussed in terms of policing, but for many communities, it also includes access to mental health services, addiction treatment, stable housing, and trust between residents and the institutions meant to serve them. What comprehensive approach would you take to improve public safety outcomes in District 63, and how would you balance investments between law enforcement, prevention programs, and community-based services? Let's start with Tony.
Definitely, being a Dubois County resident, the thing that comes to mind here is a lot of that drug treatment programs and mental health programs. They need to be better funded. They need to be better advertised. People need to know that they're out there. We need to normalize getting help and treatment before they get to jail. Basically, there's no reason, for the most part, whenever people go to jail, they start to see these things and start to grow, but there's no reason that they can't do that beforehand. And, a lot of times that's personal choice, but again, a lot of times it's just not knowing what's available. As far as, policing, we have to make sure that the communities that are in this district and across the state, have that adequate funding. If they need help from the state, then that's something that should be able to be worked out, but just mainly making sure that we have that trust between the community and get some programs going to where we can get more community involvement.
Thank you. Adam?
Well, As far as law enforcement, one aspect I have is I don't want to treat the police officer as the jack of all trades, because there's a lot of different circumstances, a lot of different situations. Not all situations need to be answered the same way. And then trying to train one person to know hundreds of situations and how to handle them. I can't expect that on a single person. So funding, putting some division, it's like opening up opportunities for different types of police officer staff, and then as well as helping all the local communities where one community has a certain type of police force, another community has a different specialization to their police force. Help let them coordinate and share resources. Uh, Unfortunately, we do have a limited budget, so there's only so much improvement to funds, but public safety gets more funding, more funding. I have to figure out where that money's coming from too. But it's sharing resources and trying to help police have more diversity in what their options are.
Thank you. Tiffany?
If we want safer communities, we really have to address what the root cause is and not just the outcomes. Too often, what we're seeing in our communities is that situations start as mental health crises or substance abuse, and they struggle and escalate because we don't have enough of the resources in place early on. Access to even mental health providers in our area is very much lacking. Unreliable broadband makes telehealth difficult. Cuts in school funding are making it harder to have, mental health providers be able to access students and deal with some of these issues early. And it's affecting families across our district, especially with the opioid crisis. It's touched nearly every community here in one way or another. And we can't expect our law enforcement officers to be mental health providers. So while we can work with them to try and get things like our RISE peer recovery program like we have here in Daviess County happening in other places, we really have to try and stop this at the problem at the beginning and give better access to mental health care, make it affordable, make it accessible, and make it easier for people before it becomes a crisis.
Thank you. Our next subject is actually affordability. Indiana gas prices are rising, surpassing $4 a gallon in many areas in late March. Grocery prices continue to rise. Fruits and vegetables are at a 2.8% rise compared to last year. There's also a spike in egg costs due to another bird flu outbreak. What do you plan to implement to help reduce costs for Hoosiers, and how would you ensure these policies have a real, measurable impact on people's day-to-day lives? Let's start with Tiffany.
So economic policy shouldn't be abstract. It should help make our lives more affordable, more stable, and more sustainable for the people that we serve. And as a legislator, I think that starts with addressing the biggest pressure that families are facing. And we need transparency in that. So when you have corporations that are reporting record sales and record, wins, and everything's getting harder for everyday people, we have to address, are we taxing them enough? Or where is this happening? Why are things costing more, but they're still producing record profits? We have to address that. And utility costs is also another big thing. There's not a lot. There are certain things that we can and can't do as a state legislator. We can't have an effect on what the national average is for the cost of gas and things like that. But what we can do is we can make sure that we are regulating our utility costs, that we are making sure that working families have affordable access to health care, and that we're not letting corporations come in and take from our Hoosier families without any sort of repercussions or responsibility.
Thank you. Adam?
Affordability, I'm going to say a lot of the problems are unfortunately on the federal level, which will be for us, the 8th district candidate will have to be the one to address those. But for what we can do in the state level, uh, data centers, I'm going to put some logic here. If they're going to be, if their addition is going to disrupt the pricing of electricity, well, they're going to have to provide something to the community to compensate, like pay for it. The other side, and then as far as everything else, well, I have to deal with each case by case study. This is where I have been leaving the state surplus comments off because it's a surplus, but I look at that as, hey, the electric company needs to build another generator station. And well, if you're raising prices because you got to afford it, we can offer a grant to pay for that, to help pay for that station so you're not raising the price to afford it. I mean, that's the use of taxes right there, infrastructure. So, unfortunately, for like bird flu, we do what we can.
Tony?
Yeah. So whenever we talk about affordability, especially here in Indiana, the main two things that are going to come up right now and this time are obviously going to be utilities and gas prices. And there's not a lot we can do on state level as far as gas prices, but we do have one of the highest gas taxes in the country, in the state of Indiana. We could look at possibility of rolling that back, even though it's just now getting ready to go back, or to increase again. I believe in June or July, somewhere around there. But at the same time, we can start looking at rolling those things back that have really starting to put the crunch on working families here in the Hoosier State. The big thing, too, is bringing that affordability down is also, like Tiffanie said, those record profits that all these corporations are touting all the time. Those don't come down to us, down towards the bottom. The Reaganomics, the trickle down economics that was first put out in the 80s. I feel like that experiment should be over by now. How after 40 years that's not failed, or in everyone's eyes, I don't know. But for those of us down at the bottom and in the middle, we know it failed long before now. It's time to start looking at ways to tax those corporations where they should be taxed. Stop giving those breaks to them, and start taxing, the higher incomes. And whenever their income's not from a traditional salary, we should be looking at ways to tax those people as well. But everybody should be paying their fair share in the state of Indiana, not just those of us at the bottom, the way it feels like it's going on right now.
Thank you. All right. Indiana lawmakers passed House Enrolled Act 1002 in 2026 with the stated goal of addressing rising utility costs and modernizing how large energy users, including new data centers, connect to the power grid. At the same time, questions continue to be raised about how utility rates are set in Indiana. The Indiana Utility Regulation Commission is appointed by the governor, and utilities and their trade groups are major contributors to many political campaigns. Meanwhile, large energy consumers like data centers are expected to dramatically increase electricity demand across the state. Given these factors, what steps would you support to ensure utility rates remain fair and affordable for everyday Hoosiers while still allowing Indiana to grow its economy? Let's start with Tony.
Yeah, when it comes to utilities, I think the first thing we need to do is we need to stop letting the utility companies focus on this word rates. In Indiana, their utility rates are only supposed to, increase so much or what have you, but yet at the same time, they're saying that they've barely increased their rates, but yet everybody's bill's gone up for different surcharges and fuel delivery charges and everything else. So when, we need to make sure that we quit leaving those loopholes for the utility companies. It is a pretty regulated industry in Indiana. However, the utility companies in this state still profit between 10 and 20%. So for every dollar that they're taking in, they're keeping 20 cents of that. To me, that's just ridiculous whenever it's for a service, something that the community needs and has to have. I would even be on board with looking at something to say, as far as the utility, the data centers go, there a lot of times utility companies will give them lower rates because they want them in their area because they're a high volume, consumer. And we could look at just saying, flat out passing a law to where, if you're going to give that rate to your big consumers, you have to give that to your smaller consumers as well. Just trying to bring back a little bit of balance and a little bit of normalcy, common sense to that whole spectrum of utility rates and how much is getting passed down to the consumer here in Indiana.
Thank you. All right, Tiffanie?
Energy costs really are one of the biggest pressures that family in our district and across the state are facing right now. I think we all can see how quickly that's all adding up. And I think that people are right to be concerned when we are seeing energy companies reporting strong and record profits while working families are struggling to keep up. And, House Bill 1002 is an attempt to address rising energy costs. And I think that it's important when we're having this conversation because families in our district are feeling that pressure. And there are parts of this bill that do take a step in the right direction, like protections for our vulnerable residents and during more extreme weather and efforts to make billing predictable. But I mean, let's be honest, the predictability of when your bill comes isn't the issue. It's how much that bill is. And most of our utilities run in a regulated monopoly. And so while I'm not a huge fan of large government, I do think that we need to have a little bit more oversight with this, and we need to force these companies to be more transparent. When we talk about large energy consumers like data centers wanting to come into our communities, those projects should not come in and drive up the rates for local Hoosiers. Full stop. If they want to be here, it should not cause problems and put strain on the people who already live here.
Thank you. All right, the next subject is housing. The average rent in Indiana is $1,399 a month. From Zillow, Adam Data rates our state as having the highest foreclosure rating in the nation. Starting July 1st, 2026, Indiana Law SB 285 will make it illegal to camp, sleep, or reside on state-owned or public property. If an individual refuses to move within 48 hours, they can be charged with a misdemeanor, resulting in jail time or a fine. Are you supportive of this law? What will you do to help the housing crisis? Let's start with Tiffanie.
So to effectively punish people through financial ways, through either fines or then through court costs or jail time, when they are already struggling, is an absurd thing to do for me. In my opinion, it is only going to continue to perpetuate that cycle of, being unhoused and, poverty. What we need to be doing is trying to help those people, lift them up. Actually, we see that there is a lack of affordable housing. We see that there is a large amount of aging homes in our area that still have a lot of life left in them. So I think that being able to incentivize through grants and through different programs to improve some of these aging homes in our area would help drive down some of those housing costs, because it would put available homes back on the market and ultimately improve the quality of life and the value of our towns and communities.
I'm sorry, I have to go back. I skipped Adam on that last question. You brought up the topic of discussions. That's why I did that. Would you like me to repeat the question for you?
I don't know. I think I actually touched on my position on utilities with whenever I talked about the affordability, which was I would it's like these data centers, they're getting a tax incentive or they're getting a tax break on their utility bills or such. And I'm like, why? That's going to it's like businesses need to be they're going to take away something from the community. They need to be adding something back into the community. And so if they're going to be driving up the electrical cost, they need to be improving the electrical infrastructure and sheltering all that cost. So, and that goes with the other utility rates. It's one, I have to research. I need to investigate the various utility companies to see what are their costs for fuel, resources, energy production, and then address that there. It's like there's profits and then there's reckless profits. So don't want to, let's continue. We can continue to the next question again.
Okay, thank you. I'm so sorry about that.
That's
All right,
okay.
we'll continue on with Tony with the housing question. Would you like me to repeat that one for you?
Yeah, please.
Okay. The average rent in Indiana is $1,399. Adam data rates our state as having the highest foreclosure rate in the nation. Starting July 1st, 2026, Indiana law SB 285 makes it illegal to camp, sleep, or reside on state-owned or public property. If an individual refuses to move to a shelter or somewhere else within 48 hours, they can be charged with a misdemeanor or a fine, or jail time, sorry. Are you supportive of this law, and what would you do to help the housing crisis?
I honestly can't remember a time when I've been more against the law. So, whenever we talk about homelessness, I don't even understand the law. They have to move somewhere else. Like how far somewhere else? 5 feet, 10 feet, half a mile, 3 miles out of the state. I think the answer there that we all know that they want is out of the state. We don't have the infrastructure that we need to have in place for homeless in this state. It's not like these people are out there because they want to be. And, at the same time, our legislature, Republican controlled legislature, wants to cut back on townships across the state. And those townships are one of those services that come into effect and to help people that are basically, being close to being foreclosed on or to losing their homes. There needs to be, a bigger connection to those services. We need to make sure that, incentivizing people to take up those older homes that maybe haven't been lived in before through different programs, so that not every house has to be a new $300,000 house. There's plenty of houses out there still, like Tiffanie said, with plenty of life in them that just get passed up for the new house down the road because they can get financing on the new house. There needs to be more incentives to be able to provide that financing for those homes that show a little bit more age to give people options to keep them off the street. And then those programs, like I said, through the local townships and other such programs to help people whenever they are struggling with medical bills or utility costs or grocery bills.
Thank you. Adam?
Well, as far as the bill on criminalizing homeless, that needs to go. I mean, we need to stop regulating living. I mean, decriminalize living here. As far as making houses affordable, that's a very messy case because of one, how are we making the house cheaper? Because we have regulations. I mean, I'm a member of our Dubois County, volunteer member of our Dubois County EMA, and we do talk about that sometimes. We do storm reports and such, and well, we have regulations on how tough a house is so that it will survive our common storms. That will raise the cost of the house because it needs sturdier wood, better joints. It has to survive a decent wind gust. And well, that's not we can't make the house cheaper. The other side is people need to get paid more. People need access to funding more. Businesses need to be investing in people more. It's a nasty situation.
Thank you. All right, Tiffanie?
I answered it first and then
Oh,
we
I'm
went
sorry.
back to Adam. That's all right. I can
so
answer it again if you'd
now.
like.
Oh, I'm good. Okay, so has everyone answered this?
Yeah.
On housing? Yes.
Okay, making sure. Okay, in 2025, the Republican supermajority passed Senate Enrolled Act 1 with what Governor Braun called historic tax relief. Here's what the so-called relief actually looks like. Homeowners got a minor credit of up to $300. Large property holders and businesses got exemptions that grow over time, and to pay for it, cities, counties, and school districts are prohibited or projected to absorb hundreds of millions of dollars in losses. Ron's response to local office officials warning about the damage: prove it and do more with less. So, what does tax fairness actually look like in Indiana? In your view, where should the tax burden primarily lie, and what would you do to address the downstream damage SEA 1 is already causing in communities like those in District 63? Let's start with Tony.
So when I first started hearing, nationwide, people saying property taxes need to be done away with, and I don't disagree with that. But anytime you stop one tax, you've got to pick it up somewhere else, or you're cutting a service. Until we can figure out where that service is going to be cut, we can't really be cutting the overall umbrella or the envelope of property taxes. But I think that our House Bill 1 kind of got that backwards. That big cut's going to the corporations and to the multiple property owners and the large properties, rather than the people owning their own residence, and that's all they own. We need to bring back homestead credits to consumers, to homeowners, that it's to help out with your primary residence. We need to lower those tax rates. We look at being rent and second homes and properties, vacation properties, things like that. And also, something else I didn't know until just recently, that a farmer who owns, his home is taxed at 1%, whenever for their homestead, but it's taxed at 2% for their property that they farm. There's no real rhyme or reason for that either. That just needs to be a little bit more common sense approach to looking at that whole spectrum of property taxes.
Thank you. Adam?
Well, I would be want to repeal that law. Property taxes, it's one of those unfortunate stories. We are a community, and the government is us working together. And in order for us to work together, we have to share our resources, and we have to find some way to say who pays how much. We have to figure out how to divvy that out. As far as property taxes go, unfortunately, it's like it works for the local governments. Local governments need it. But I'm probably going to say I'll probably allow a progressive system on property taxes. Not just saying it's a static number, but a progressive system, or some way of saying, look, you only own one house. You should be getting, that tax credit should be minimizing the damage that property tax does to you. But if you got multiple properties and you're able to afford all of those, you probably should be putting in a little more of a cut into the community to help the coffers here.
Thank you. Tiffanie?
People need relief, everyday Hoosiers, but we have to be honest about when we make those decisions, how they impact our schools and services and local communities, because property taxes are absolutely a very real concern for families right now, especially with rising home values and the cost of living. And so people are feeling that pressure, and they deserve some actual relief. But property taxes fund essential services. They support our schools and our emergency services and our roads and day-to-day operations. So when we make those changes, we can't pretend that there aren't consequences. And if the revenue goes down like it has with SB 1 without actually giving Hoosiers real meaningful tax, more back on their taxes, $300 to most people isn't really going to make a big difference in their annual budget. We have to really decide, is that worth what we're losing? And we should be providing targeted relief for the most vulnerable, the people that need it. Seniors that are on fixed incomes and working families, not corporations or large property owners like that. We have to make sure that we're not unintentionally weakening the communities that our people rely on every single day.
Thank you. Okay, our next subject is education. Indiana recently implemented ABA therapy restrictions, capping services to 30 hours a week and a 3-year lifetime limit. 1 in 5 third graders struggled to read. What is your plan to address literacy concerns in your state and county? Adam?
Well, I don't see it. Probably remove the caps. We need to address the literacy problems. Exercises help. I'm going to have to say that I'm going to have to give that to an expert on the actual case, but more support. I want to put more funding into education in total. So more support, help these individual cases, help literacy on the broad side. Sadly, it's like we had plenty of opportunities when I went through school, but if I'm hearing now that those opportunities are disappearing, I want those opportunities back.
Thank you. Tiffanie?
I have two adult children now who went through our public school system. So I understand that difficulty of teaching children to read and how that works, but taking funding away from our public schools through either SB1 or through the school voucher program that is decimating, honestly, the budget of our public schools is not the way to improve our literacy scores. Giving more control over our education goals and how our public schools are structured giving that to the governor is not improving our literacy scores. How we do that is we decrease class sizes. We improve funding for our public schools. We make sure that we are attracting and keeping and retaining good teachers by giving them livable wages, by not asking them to continue doing more with less. We fully fund the schools that teach 90% of Hoosier children, because ultimately what we are doing is building the future of our state. And continuing to cut that is only going to lead to decreasing scores across the board.
Thank you. Tony?
So, as both of them hit on really well, education problems come down to funding for the most part, especially in the public school system. Those voucher programs do hurt the public schools. That the sharing, the property tax sharing that the public schools have to do going forward with the charter schools is going to make that impact even more on the public schools. So basically the state, rather than giving the $1,400 per student to charter schools, it'll have to start coming out of the public schools fund. So basically the state's saving $1,400 per student, but the charter schools are still seeing that money. So it's not only are we not giving public schools the money that we've been giving them, but we're also cutting more of their budget back. Smaller classroom sizes, especially in grade school, even if that means smaller schools, more schools in elementary school. The other big thing is getting children involved in education early, especially in lower income areas, those pre-K and those Head Start programs. We need to implement more of those across the state. We need to get kids into classes whenever they're excited about learning in an environment they can be excited about learning in. And we need to be able to fully fund those across the state of Indiana to get those kids in before 4 or 5 years old, so they can start learning early and get excited about learning and feel like that they've all come in at the same level into those first few years of school.
Thank you. The state's child care voucher program has been closed to new enrollees for over a year. The waitlist has toppled 30,000 children. No new vouchers will be issued until 2027. And while families wait, the state slashed reimbursement rates to providers, cutting payments for infant care by 10%, preschoolers by 15%, and school-age children by 35%. Providers are closing, families are making impossible choices between work and childcare they simply can't afford. This season, Republicans passed HEA 1177, expanding the tax credit for employers and allowing local TIF districts to fund childcare, a drop in the bucket for 30,000 kids on a waiting list. So here's the question. The state's constitution treats K-12 education as a right. Should it treat childcare the same way? And what would that actually look like in practice? Let's start with Tiffanie.
So, whenever I was a single working mother, I did apply for that daycare voucher list and was told that, and this was in the early 2000s, and was told that that wait list was years and I would never get on it. And I didn't. And as a single mom, that amount would have made a huge, huge difference in my life and in my budget. And for working families right now, they shouldn't have to make that choice between, are we a dual income household, which right now, let's be honest, our economic world almost requires that, or does someone stay home because financially it doesn't make sense? You cannot want people to work and have a strong economy and then take away the daycare and childcare options. While I don't think that it is necessarily a right, like our K through 12 education is, I do think that it is something that we shouldn't be punishing young families with. I don't think that we should be punishing single mothers by making it more difficult to get ahead. And we do need to absolutely compensate our daycare and our childcare providers adequately, because that is one of the biggest struggles with trying to find providers, because financially it just doesn't make sense at times for them to stay open and to remain, because it is just such a low reimbursement and just a low wage for working people, primarily women in that field. Having been one myself, I understand that struggle very much and have seen it firsthand.
Thank you. Tony?
Yeah, so I don't necessarily think it's a right, like education. But then again, I don't, our K through 12 education is only a right in the state of Indiana because it's in the Constitution. Because, at some point we all decided that it was for the common good of the state. Expanding these pre-K programs and the Head Start programs in Indiana, can help a lot of those lower income. Really, it's going to help anybody with children to be in the public education system, rather than just being at somebody's home, in childcare or in a daycare center. But we do need to, we're once again talking about cutting, cuts to the budget. Whenever I don't understand why they keep talking about, how they've had to make all these budget cuts, whenever, all of our current legislators in Indianapolis and that administration, keeps touting how much budget surplus we have in Indiana. I understand fiscal responsibility. I understand that we can't just throw money at every problem we have. But then again, at the same time, we can't keep pulling it back from every problem we have either, or everything that's already a problem in this state and making it a bigger problem. We need to keep that budget there and stop cutting those services to those that, the people in Indianapolis, a lot of them probably aren't using these services, so it probably doesn't mean a lot to them, but to those of us Hoosiers that are using those services, those cuts mean the world to us, and they really put even more of a hard time on the hard time we're already having.
Thank you. Adam?
Childcare. Well, that reminds me of a little town hall meeting our Jasper Chamber of Commerce had last year in January with our local legislators. And the big statement there was they don't know how to get families to procreate. And well, when you don't offer the balance of family life, work life, don't have some way to compensate for this person has to work 60 hours now to afford everything and to afford a family. They just don't have the time for the family now. I'm going to say childcare should be treated as a right because it's necessary for family. And If you want families, you're going to have to find some way to create the families here. And well, it's like you're going to have to figure out the balance between making all your Hoosiers slaves to business or actually giving them the freedom to have a family.
Thank you. All right, for the final round, we're going to do a speed round, just yes or no. We're going to go Adam, Tiffany, Tony on these. The first one is, do you support the recent lift on conversion therapy ban? Adam?
Lift.
Yes, no.
Can you repeat that question again?
Yes, of course. Do you support the recent lift on the conversion therapy ban?
Lift on the conversion therapy ban? I don't know the topic enough to answer.
Okay. Tiffany?
No.
Okay. Tony?
No.
Okay. If elected, would you support Indiana joining the National Popular Vote Interstate Compact? Adam?
Can you repeat that again?
Yep. If elected, would you support Indiana joining the National Popular Vote Interstate Compact?
No.
Okay. Tiffany?
That's a topic I would need to do some more research on.
Okay. Tony?
Yes.
Okay. AI restrictions? Adam?
Yes.
Tiffany?
Yes.
Tony?
Yes.
Data centers in your county? Adam?
No.
Tiffany?
No.
Tony?
No.
Should there be a mandatory swift path to citizenship for undocumented immigrants? Adam?
Can you repeat that question again?
Of course. Should there be a mandatory swift path to citizenship for undocumented immigrants?
Maybe.
Okay. Tiffany?
Yes.
And Tony?
Yes.
Should the minimum wage be increased to a living wage? Adam?
Yes.
Tiffany?
Yes.
And Tony?
Yes.
For-profit prisons? Adam?
No.
Tiffany?
No.
Tony?
No.
School privatization? Adam?
No.
Tiffany?
No.
Tony?
No.
Healthcare for all? Adam?
Yes.
Tiffany?
In an ideal world, yes.
Tony?
Yes.
All right. Should self-driving cars be permitted on public roads? Adam?
No.
Tiffany?
No.
Tony?
No.
Is the American dream realistic for average Americans today? Adam?
No.
Tiffany?
No.
Tony?
No.
Is it ethical to use drones in warfare? Adam?
Yes.
Tiffany?
Possibly.
Tony?
Yes.
All right. And one from the comments, cannabis legalization. Adam?
Yes.
Tiffany?
Yes, with guardrails.
Tony?
Yes.
Okay. And now we will start with our closing statements. Let's start with Tony.
So, as you know, most of the audience has probably already realized, those of us three candidates being all on the Democrat side of the primary, we agree on a lot of issues. There's just a lot of common sense needs to be returned to politics. We need to stop demonizing those that are less fortunate than us. We need to stop, kicking them while they're down and start lifting them up out of the hole that they're in. The system in this state has been far too long profits before people. It's put our health at risk. One of the worst states in the country as far as our natural resources, cleanliness of water, air quality. That's affecting our health at the same time. It's affecting the amount that we miss work. It's the amount that our kids miss school. Our healthcare in this state, suffers a lot because of just putting those profits before people. The big thing too that I want to hit on, whenever it comes to picking one of us three as a candidate, you're going to be voting for a lot of the person and not the ideals, because a lot of our ideals are the same. I just want that opportunity to go to Indianapolis and fight for a little bit of common sense and a little bit of order back into politics. We need to bring that conversation back to a civil level. And I do want to, one big thing is, the media wants us all focusing on that 1% that we don't agree on. While 99% of the issues in this country, we agree at least to a certain level of what needs to be done. Maybe not exactly how to do it, but what needs to be done at the same time. And we really need to be able to restore that conversation back to that 99% of issues and get off of that 1% that's really just an agenda for the other side, and try to govern and help the people in this state, which is what this government's supposed to be for anyway, is a service to the people that put it in power.
Okay, thank you. Adam?
Well, as you saw on some of those speed questions, I have to say maybe or need more research, like conversion therapy ban or such. There's some words that end up twisted, and that's one of the points I have is I don't want to call myself left, right, or center, because these three words are meaningless in the political meaning, because we keep changing their definition. And what does it mean anymore? I mean, anytime we change, it's like, well, Democrats are more left. And then if Democrats decide to change a view, that new view now becomes the left. When really it's like, we're not really left. We're somewhere, we're just scattered across the field. And that's one of the things I want to fight is twisting words to mean something else. And as Tony was pointing out about like focusing on that 1% where we're all different, that's where our voting system breaks down, because we end up voting for somebody because he supports this 1%, despite he is the worst person of the other 99% of all qualities required. Whereas we're all divided on the other people who are more qualified, and our votes get diluted. I want to bring in sensibility. I want to bring accountability back into the system. Government is supposed to be the consolidation of the people and our efforts. It's for the people, of the people, by the people. And we need to kick the vehicle that's called business out of it.
Okay, thank you. Tiffanie?
So tonight we've all heard a lot about policies, and those definitely matter and are important. But really, at the end of the day, this race is about people, families that are across District 63 who are working hard every single day and doing everything right, and still feeling the pressure of rising costs, of limited access to healthcare, and decisions that are being made without their voices at the table. And I'm running because I've lived those realities, and I've spent years showing up for this community, whether that's been working with children, supporting families, building my small business, or standing alongside our neighbors when issues impact our homes and our future. And when I made the decision to run, I didn't step in halfway. I've been all in. I've been out in our communities listening and learning and really trying to do the work that's going to make me a successful legislator if I win, because I believe that's what this role really requires, not just during an election, but every single day. So this isn't about just a moment or a stepping stone for me. It's about a commitment. And that commitment is to show up and to listen and to fight for the people of our district. It's to make sure that working families are at the center of all of the decisions that are being made to protect our communities and our land and really our way of life. And It's to make sure that when you feel like no one is listening, that you have someone who will in me. Because I truly do believe that our government should serve the people and not the other way around. And ultimately, no matter what happens in this race, I will continue doing this work. I'll continue standing up for our communities and fighting for a stronger future in District 63.
Thank you. And thank you sincerely to each of you for taking the time to do this debate tonight. Thank you all for joining us, the viewers. Make sure to follow and subscribe to the Progressive Indiana Network for more Democratic news and events in the state. The next debate will take place Saturday at 2 p.m. Eastern Time, featuring the Democratic candidates for State House District 48, located in northern Elkhart County. Have a great night.
Bye, everybody.
Thank you.
Thank you for having us.